Kidney stones are silent killers. They don't make a fuss until it's high time to attack. Signs and symptoms won't manifest for months, years, or even decades, and they can go undetected unless you undergo a urinalysis. Kidney stones may take you by surprise, but if you're vigilant enough, these small guys won't really take your life away. In this video, you'll learn about the causes, signs and symptoms, and treatments for kidney stones that you should be aware of before the tiny crystals grow as large as a tennis ball. Kidney stone disease, or nephrolithiasis, is quite an easy condition to deal with because observing a healthy diet and drinking plenty of water may suffice in the prevention of kidney stones. However, there are certain factors that may contribute to kidney stone formation, and you may find it inevitable if you have any of these. Here are the common causes and risk factors of kidney stone disease that you should know before you start looking out for the signs and symptoms. This may also allow you to avoid further chronic kidney disease. Number 1. Low fluid intake. Water flushes away the wastes from your kidney in the form of urine, so it is understandable that staying hydrated at all times can save you from kidney stone disease. For less serious cases of kidney stones, most doctors just perform simple observations and advise their patients to take medications or painkillers accompanied by drinking lots of water. Medicines like alpha blockers are given to patients to relax the muscles in the ureter, making it easier for the small stones to pass through. 8 to 10 glasses of water are not only intended to quench your thirst or promote a healthy blood flow, but they are also necessary for your kidneys to function properly. Number 2. Too much salt. Sodium is probably the most harmful compound for your kidneys. It removes less water from your kidneys, which may lead to dehydration and concentration of compounds in your urine. Other compounds that are found and may accumulate in your urine are calcium, potassium, phosphate, oxalate, and uric acid. Together with high fluid intake, you should also avoid a high-salt diet to prevent the formation of kidney stones. Some foods that contain high sodium content are processed meats like ham, hot dogs, bacon, and sausages. You must limit your intake of frozen breaded dinners such as pizza and burritos. There are also naturally sodium-rich fruits and vegetables such as pears, avocados, pineapples, bananas, and watermelons. Number 3. Family history of kidney stones. If you have an uncle or a grandfather who had suffered from kidney stone disease before, chances are you will also acquire the condition if you won't be careful. If your parents or siblings are also complaining about it, you probably should start seeing your doctor to check if you may be at risk of kidney stones too. Hereditary diseases may be difficult to avoid, but they can be managed through early diagnosis and practicing a healthy lifestyle. Number 4. Medical conditions. If you have hypertension, type 2 diabetes, or gout, you are prone to developing kidney stones. Insulin resistance in diabetes can elevate calcium levels in your urine, thus making it more acidic. Acidic urine can lead to uric acid stones, and it can be cured by increasing pH levels and breaking down the stones into smaller pieces. Being obese or overweight can also put you at risk of kidney stones because people with larger body size tend to consume more protein and salt in the foods that they eat. More animal protein and salt in your diet can lead to the accumulation of more compounds that may form a hard mass of crystals in your urine. Do you happen to have any of these factors or causes? Tell us about it in the comments below and let us help one another in the prevention of kidney stones. As we have covered the primary causes of kidney stones formation, let's try to understand what are the symptoms of kidney stones. Unlike other diseases in which your body tells you right away if you have them, kidney stones go quiet and asymptomatic until it starts moving down to your urinary system. You won't feel any signs or symptoms unless the stones grow big enough to block the normal passage of your urine from your kidneys down to your bladder and urethra. Here are the common signs and symptoms that you would feel if you have stones in your kidneys already. Number 1. Flank pain. If you're experiencing a sharp, sudden pain in your lower back and the sides, you may have kidney stones that are beginning to come out of your body. This pain usually radiates to your lower abdomen, and this also comes in waves. The pain may be bearable at first, but it can be severe as well. You would find yourself continuously moving in order to find comfort. A burning sensation while urinating called dysuria may also be felt at times. If it's a minor case, your doctor may only recommend pain relievers and plenty of water to reduce the pain and break down the small stones. Number 2. Nausea and vomiting. Nausea and vomiting are among the first signs of kidney stones, and these happen due to the severe pain caused by the passing through of the stones to your renal system. Other signs that may occur are fever and chills when infection happens to your kidneys. This fever, however, is not an ordinary symptom because it seems to not go away for days. You should see your doctor if multiple signs persist to determine the type of kidney stones that you may have. Kidney stones are detected through urinalysis, and they could either be made of calcium oxalate or uric acid, as 80% of kidney stone crystals are made of calcium oxalate. Number 3. Cloudy urine and blood in the urine. When there is an infection, a cloudy or more turbid urine may occur, and you may also observe pus or white blood cells when you pee. The normal color of urine is white or yellowish, so if you find your urine color orange or brown, it may indicate that you have kidney stones. Hematuria or blood in the urine also occurs when the stones find it difficult to pass through your ureters and they scratch the walls of the tubes. These scratches may cause your ureters to bleed, thus sending blood into your urine. Blood in the urine can be macroscopic or microscopic. Macroscopic means that you may observe blood with your naked eyes, and microscopic is when little blood is only visible and may be observed through the use of a microscope. Well, if this all sounds horrible already, we have some good news for you. If you wondered if there are treatments for kidney stone disease, there are actually 3 methods that may help break down or remove the stones from your kidneys. The first 2 are considered non-surgical and are called shockwave lithotripsy and ureteroscopy. Shockwave lithotripsy is done by transmitting high-energy shockwaves to your kidneys through the use of wires. They are directed at the kidneys, and the shockwaves break down the stones into smaller pieces for them to easily pass through the ureter. Meanwhile, in ureteroscopy, a small instrument called a ureteroscope is inserted into the tubes that connect your bladder to the kidneys. A laser fiber at the end of the ureteroscope breaks up the stones into dust-sized particles with the same goal of allowing the small stones to pass through the ureters easily. Both shockwave lithotripsy and ureteroscope are outpatient procedures, and patients may go home on the same day. They are also likely to succeed in removing the stones, but you may need to have another session to completely take them out. These non-surgical procedures have low risks as well, although some side effects such as back pain, discomfort, frequent urination, and blood in the urine may occur. On the other hand, a surgical method called percutaneous nephrolithotomy is performed by making a small incision in your back. The surgeon will insert a tube into your kidneys to remove the stones. This surgical process, as well as ureteroscopy, requires a plastic instrument called a stent that will hold the ureters open. Percutaneous nephrolithotomy has the highest success rate in taking out the stones from your kidneys, but it also puts you at a higher risk of serious bleeding. Patients might need a blood transfusion if this happens. Kidney stones are not considered a life-threatening condition unless an infection occurs. However, you should keep in mind that taking it for granted may lead to costly treatments, or the severity of its symptoms may eventually impair your normal life. Did you enjoy watching this video? Give us a like if you did, and don't forget to share this with your friends on social media. We still have amazing videos related to this topic, and you may like them as well. Check out our videos about creatinine and how to lower creatinine levels, or how to identify the symptoms of creatinine. Give it a go and let us know if you enjoyed them.